Good morning, Mr. Mancini. My name is Sufin, and I'll be your level 2 nursing student today. And I've just reviewed the orders that the doctors put in, and they have ordered 2 injections for you. And I'm just going to be giving those to you. It'll take a couple of minutes. If you have any questions, let me know. And I just want to say before we start, everything you say is between me, you, and the healthcare team. Name and date of birth for me. Okay, perfect. I was just making sure that you actually is you. I was just looking at the patient identifiers. And now the doctor has ordered 2 medications for you through injections. One of which is heparin, other one is Haldol. Haldol is intramuscular, which means that they'll either be giving on the ventrogluteal side, which is kind of like your upper buttocks area, and the other one will be deltoid. We'll give it on the deltoid side just because it's easier to get to in this case, and it's appropriate for that. Heparin is more of a subcutaneous injection, and that will be given at the abdomen, thigh, lower back, or upper arm, and we'll just give it in the abdomen area just because, again, access is easier and that seems to be the most appropriate site. The medications for Mr. Mancini. It's important to review the MARs to make sure that we're giving the right medication, and it's also important to have the patient rights in mind. And now let's get to the medications. Since we're giving 2, one is subcut and subcutaneous, and the other one is intramuscular. The subcutaneous gauge will be between 25 to 27, and the needle length will be 3/8 to 5/8. And then for intramuscular, it's gonna be the gauge is gonna be between 22 to 25, and the needle length is gonna be 1 inch to 1.5 inch. And these are our 2 needles that we'll be using. And I'll also make sure that another nurse checks over my math before I actually administer the medication to our client. We're going to be calculating the doses that should be given to our client. And we have the first med we have is heparin, and heparin's dosage strength is 5,000 units per milliliter. And the doctor has ordered 5,000 units. Therefore, we'll be giving 1 milliliter of heparin. The next one is Haldol, which is intramuscular, and the doctor has ordered 1 milligram, and we have 4 milligrams per 2 milliliters at hand. And after doing dosage calculations, we'll be giving 0.5 milliliters of Haldol. The vials that we need will now be just preparing the medication. So first, do some hand hygiene, and now what's going to happen is I will pop off the safety caps, put the alcohol swabs on it to keep it sterile, and then put the appropriate amount of medication in the syringes. So now first we'll be doing the heparin. We're gonna get the alcohol, keeping it sterile, just gonna wipe it a bit and then just keep it on. And now we have our syringe. So this is the 1 milliliter syringe, and then you put the needle. Gonna lure lock it. And since heparin is 5,000 units per milliliter and the doctor has ordered 5,000 units, we're gonna put 1 milliliter. That's perfect with the size of the syringe. Gonna put the safety cap back, take this off. Still sterile. I'm gonna put in 1 milliliter of air in this. Remove this. We're gonna aspirate this so it just makes it easier for the heparin to come back in. Turn it upside down. I put a bit more than 1 milliliter because there is air bubble on top. So I'm just gonna smack this until the air bubble goes away. And push this on top. And it's perfectly 1 milliliter. And now since this is prepared, we're gonna keep it just on the side. And we're gonna label this as heparin. We don't want the medications to be getting confused. Heparin is prepared. The next thing we're going to do is prepare the Haldol. Haldol, the doctor's ordered 1 milligram. We have 4 milligrams of 0.2 milliliters at hand, so we have to put 0.5 milliliters. So again, the same procedure. We're going to take the cap off. We're going to take the alcohol swab. Just keep it sterile. And now we're gonna take our syringe and the needle. Lock it, move the safety cap back, take this off. Put 0.5 milliliters in there. This is done, so then we're gonna aspirate this. This is done so we don't lose any medication. Again, I'm gonna put a little bit more than 0.5 milliliters just because there is an air bubble in there. Perfect, there's no air bubble and it's perfect at 0.5. We're gonna keep this on the side and then just label it as Haldol. Okay, now that we've prepared our medication and the syringes are ready, we're just gonna inspect the sites to make sure there's no lesions and the skin is healthy. So Mr. Mancini, I'm just gonna be giving you the medication the doctors ordered. And there's two. One is intramuscular, which means that it'll be at your deltoid muscle. We want to give it at the deltoid muscle because it has a rich supply of blood, and the medication will go around pretty quick. And the next, and the other one is subcutaneous, which we'll be giving at the actual abdominal area. There are multiple sites that we can give it at, but just abdominal is the most accessible one. It's the easiest one in this case. So I'll be giving the heparin, which is subcutaneous at your abdomen, and I'll be giving the Haldol at your deltoid muscle. And now I'll just put my gloves on. We want to put on gloves to make sure that we sort of maintain cleanliness, sterility, and also that when we give the needle, just in case there's bleeding, we don't get the patient's blood on our hands. And now, after inspecting the skin, so the first I'll be giving the heparin, which is subcutaneous at the abdomen. I've already inspected the skin, so this is the label, it's taking it off. I've already inspected the skin to just see that there's no other lesions. Take the alcohol swab. We gotta leave it for long enough for it to dry. So we gotta make sure that the alcohol actually dries off. Keep this closed just in case we'll need it after we've given the injection. So now that the skin is dried off, I'll be taking my needle. This does not go in a 90-degree angle. It goes in more 45-degree angle because it's subcutaneous. I'll be using my index finger and then just pinching it, going it at a 45-degree angle, and injecting. And I'm gonna get my alcohol swab before I take the needle out. Place it there. Put the safety on. And we will keep pressure for about a minute or two just to make sure that there is no bleeding, excessive bleeding, and to make sure that the medication actually doesn't come out. And after a minute, we'll discard these in the appropriate discard. So this will go in the sharps container, and then this will go in the cartridge. Hello, Mr. Mancini. Now that I've prepared your medication, I'm just going to give you your intramuscular injection. This will be given in the deltoid muscle, which is in your upper arm. And the way it's going to work is I'm just going to clean the area, then I'll pinch it, and then I'm going to give you the needle. If you might feel a little bit of a pinch because of the needle going in. If you feel any more discomfort, just let me know, and we can stop the procedure. Sound okay? Okay. So now, first I'm just going to clean the area with an alcohol swab. We have to wait for the area to dry. So we gotta wait for the area to dry. We're gonna assume that the area has dried. So now, Mr. Mancini, could you just take a couple of deep breaths? And the reason we tell him to take a couple of deep breaths is that we don't want the muscles to be contracting. We don't want them to be tense. We want them to be loose and relaxed. Okay, now that Mr. Mancini has taken deep breaths, I'm just gonna pinch the skin and pop the safety cap back. And going at a 90-degree angle because this is for intramuscular. And we're gonna aspirate back a bit to see if there's any blood coming through. Since there isn't, we're good to inject. The reason you want to do that is So if there's blood coming back, it means you have went too far into the muscle. And we're gonna take our alcohol swab, place it, pop the safety back on, and now we're just gonna hold it for a minute or two just to make sure that the medication doesn't come out of the injection hole and that there's no excessive bleeding. And after we've held it for a couple of minutes, we're gonna throw this in a Schweppes container and then dispose of the alcohol swab accordingly. I've performed the procedure. I've disposed of the gloves. I'm just gonna do a hand hygiene. And now I'm gonna go to document. Documentation will be how Mr. Messine tolerated the procedure, whether if he was comfortable or not. And on the Mars, I'll also document what medication I injected, the way I injected it being subcutaneous intramuscular, the dosage, and yeah, so that will be recorded in the Mars, and then I'll also record how the procedure was tolerated. After doing that, in the next few minutes, we'll watching for any adverse side effects that the medications may have. And that was the walkthrough of how to do IM and subcut injections.